I'm not sure if this one's going to be for posterity or if it's going to be just information. So, little background on me is I used to be a dental laboratory technician. Okay, yeah, those hard acrylic retainer things. Yeah, there's a good chance that I might have gotten them started in their popularity. Yeah, made one in like what 1998 for captain in the military. Conflict of schedule, whatever. She was very pregnant. Made them. Her orthodontist, who was a civilian, absolutely loved him. And I insisted when my daughter had her braces that my sister make sure that whoever made her retainers, that my daughter did not have Hollies because they are a nightmare and they don't work. That she had the clear acrylics, and she still uses them to this day to make sure that her teeth stay straight. Anyway, yeah, that was me. Yeah, I should have patented it. I probably would have made a lot of money. Anyway, they've been around for a long time. Just nobody made them a standard, you know. I did it on a whim. I created the design in itself in a way because she still had her braces on. So I literally had to intricately carve all of the braces brackets off of this casted impression, which was very ugly. We did an alginate, and I had to kind of guess. So with the concept of guessing, I made sure that I left the areas of like the cervical areas and the incisal areas intact, and then I went ahead and bulked up, left a little bit, kind of questioning, right? And I said to her, I was like, if it feels like if you were to take like toothpaste, rim these with toothpaste, okay, and then smush them up in there, and you see that there's toothpaste, you can see the toothpaste, use the colored stuff so you can see what the fuck you're looking at, right? Use the bleach gel. And then she was like, oh, no way. I was like, yeah. I said, you'll be able to clean up around where the brackets were. So they were kind of dual purpose. I said, it'll squeeze out. I said, because I'm cutting your incisal edges of this retainer off. You're going to have the lingual sides to support back here. But the central area of the tooth, outside of the collars, which are right up against your gums, and the very edges here, where your braces weren't at, they're going to fit snug. I said, but if they need to do a mild bleaching or whatever, there's going to be a little bit of space there, because I didn't want to cut it down too far. Otherwise, it ain't going to fit, right? She's like, oh, I get it. So I had cut off the incisal edges and the occlusal aspects of these, so they looked like little like horseshoe donuts kind of thing for her teeth as a makeshift, because she was pregnant. She wasn't going to be able to get to the orthodontist. They needed something. She was going to get her braces off. Everything was conflicting. Her schedule was like, it was completely bizarre. And when one of the dentists that was close to my age, she was like, can you do this? And I was like, I can do it. But, is it going to be long term? Probably not. I mean, it's going to be as long term as the patient and the doctor think it's deemed worthy. But if she needs to come back, we can, after she gets the braces off, couple months down the road, whatever, if she wants me to make another set, I can do it. It's not that big of a deal. But, quick, fast, and hurry, yeah, let's do it like this. That way, she's not having, so when I did her lower, I also cut the occlusal aspects off and the incisal so I could occlude them. So that way, she could wear them without feeling as though when she clenched or bit down, that these things were going, they're in the way. Now, Hollies, they have these little like metal brackets that go between the teeth, and they got these little ball clasps. Sometimes they have like little like C-clasp type of things that set them and lock them onto the teeth. And those little metal things, you can they're fucking annoying, right? Just saying. And a lot of people stop wearing their Hollies, and their teeth get really crooked. They don't maintain. Hollies are very forgiving to the natural functions of the dentition. So they help, but they're not great. Unless you're going to get a permanent retainer cemented into like the lower dentition, they're going to go crooked again. Psycho X did not have a permanent retainer in his bottoms. And his bottoms were funky, but his tops were beautiful. Just putting it out there. So, watching this dude, God, what is it, 3 on 6, I think it's called. I don't know, he's a fucking dentist. He does implant type of shit. That is my biggest fear. Now, I don't have great teeth, even though I am a dental laboratory technician by trade, 15 years. I did this. I could fall right back into it if I wanted to. Not that ambitious, because I get really frustrated with the moral ethics of dentists and their shit work that they produce. And a lot of them are going for the digital stuff. So the digital, like, I have an onlay, like, that's an onlay. It was done digitally. I watched it get carved in a computer while I was in Germany. Fits great. No leakage. Yay. Anyway. I couldn't have done better in the lab. Anyway. I've done 5-span bridges in gold. Waxed them up. Thrown the gold. Polished them up. They're in somebody's mouth. May not be anymore. It's been 20 plus years. But the point is, I run across a lot of this stuff that is like of personal interest to me to see where the technology has gone. Where has it evolved to? Implants. My sister has an implant for a molar that was like endodontically compromised after she gave birth to her second daughter. She got it yanked. They went ahead and they put a stem in with one tooth and good to go. Now, I keep seeing these full-on denture apparatuses. They were starting to become a more popular item while I was still working in dental laboratory. And I was building a database for the dental lab that I had worked for to keep track of all of the different parts that were available. So I was going through my dentist that I worked for. So I worked for kind of an in-house laboratory. There was like 5 of us in there. Plus him. He didn't do a lot of the treatment plans. He had like 1 or 2 patients maybe once every 6 months. He wasn't doing high production dental laboratory in-house. A lot of what we did was for a lot of dentists that were out of network, kind of thing. He had one or two special cases that he would focus, and he would spend months and months and months on that particular person. And we had one where he was designing the implant type of thing, and it was, we had the full form articulator, full function, and it, survey crowns and the whole fucking 9 yards. So some of this individual's work was bridge work, some of it was implant work, some of it was partial denture work. He had all of it going on, right? So, when we really got down to the skinny, he had like 2 teeth that were like holding strong, and then we had a couple of them back here, so we had a partial denture network going on the lower, right? And then this front 6, we went ahead and they did like a 6-span bridge with porcelain on the front. But then the back teeth, corroborating with the lower, on the lower denture in the back, they did implant mechanisms for the top teeth to correspond to the bottoms. So this guy had everything going on in his mouth. So, given that kind of situation, yeah, I've seen it all. So this guy, he was going on details of how they do bone reduction, why they do the bone reduction, because of this design and that design, and how a person smiles and whatnot. Now, I'm going to admit to you, within the next, I would say, 5 years, I am going to be going into dentures. There is no doubt in my mind. These bottoms here have always been a mess because they're super crowded. And now they are very, very mobile, and they are very sensitive. I have a tooth back here that I could probably pull out with my fingers if I wanted to. And all of these, because of that fucker back there, and this fucker back here, because I got the teeth back here, behind them, pulled 15, 16, 17 years ago. When was it? 2009. 2008. I got these back teeth pulled. So they were my second molars. Because they were sharing a socket with my first molar. My third molars, whatever. Wisdoms were pulled when I was 17. Second ones got pulled when came back into the military. And the first ones are still sitting here, right? These first ones, I could literally probably pull them out with my fingers. Because they were sharing a socket with the ones that were behind it. And they were all hoping, oh yeah, the tissue will fill it in and everything will grow back. No, it did not. So we had fucked up teeth, right? That's why I have spaces right here. These were never here. I never had spaces. Forever and ever and ever. These just came in within the last, I would say, 3 years. So, being a dental laboratory technician gives you a little bit of foresight. I am scared to death of dentists. They scare me to death. Because I have worked for some butchers. And, yeah. I've worked for some butchers in the civilian world that basically traumatized me to a point where I was like, I don't want anything to do with this. However, while I was in the military, I worked for some of the best fucking dentists alive. My colonel was a textbook perfect. This man was incredible. And a lot of the other constituents that I worked with were incredible. Never had a problem producing anything in that laboratory for these people. And I say people because it was females too. We had female dentists. They were incredible. I can say that there was only two in the 7 years that I was there. 3. And one wasn't even stationed with me. He was at Fort Benning. He was a butcher. But 2, that I would question the product because they just didn't have the hands. So, I watch a lot of this content only because I'm curious on the full denture aspect of it. You know, what my dentist was doing when I was working in his lab was onesie, twosie, partials, things like that. Like, so what we had for that one individual, we were doing like a 3-span. So he would do like a screw, a space, and then a screw. And then we would bulk it up, and then we would make this 3-span that would screw in. He had a 6-unit bridge, so it would go like 6 to, 6 to 11. Yeah. 6, 7, 8, 9, 10, 11. Yeah, 6 to 11. Memory's slipping. Anyway, so my memory's slipping. 6 to 11. So yeah, it would be cuspid to cuspid. He would have a 6-span bridge. So it would be 1, 2, 3, 4, 5, 6, right? But from bicuspid to molar, he would have an implant in the bicuspid region, a space, and then you have an implant for the molar region, right? And if they wanted another one, they'd have another implant for a singular unit back there. He'd never do a 2-span on the cuspid. Why? He did it all the time, bridge work, but the molar takes the most force. This molar that I have right now takes the most. That's what's weakened it. That is the reason why. I mean, I could literally probably pull it out with my fingers. But anyway, and it is to prevent a super eruption or a compromising dentition on the backside on the lower. A lot of people, they question, why are they doing it like that? I had a great dentist who was periodontal, endodontal. I mean, he was like all specialty. He's like the best guy ever. I'm going to name drop him. His name was Dr. Dolsky. His bedside manner is like that of Lurch. He's just like totally cold, right? And yeah, there's Yelp reviews out there. He's just not sensitive. He's just not a fucking sensitive, compassionate fucking guy when it comes to teeth. He's more on like a mechanic. Your fucking engine's failing. Fix it. You got 2 choices. It's gonna fall out of your head, or we can fucking replace it. And he's from New York, so he has. I got him. He loved me. You know, me and him would be like, I asked him, I say, why are we only doing 1 tooth? He's like, yeah, because the rest of them are going to fucking fall out. So every month I'm going to be bringing you back this, and we're going to have to add a tooth. I'm like, oh my God, is it that bad? He's like, it's that bad. I'm like, all right. Good to know. Realistic and totally insensitive at the same time. Love the guy. I fucking loved him because he got me. Anyway, I was so bored one month. We didn't have nothing going on. I think all our guys were out like in the field or doing something. And I sat in the back at the desk and I literally with an X-Acto knife carved out this real weird fucking dragon stencil. And he's like, "What you doing?" I said, "Trying to keep my brain alive." And he just started laughing. He's like, "What? That looks pretty fucking cool." I was like, "Yeah, maybe I'll stencil it on something someday." He's like, "What are you doing?" I was like, "The lab's clean. I got no work coming in. I'm about to leave for school. Everybody's like nervous. I'm waiting for my replacement to get here. You know, yeah, life is, I am so fucking bored right now." He's like, "Looks like it." He goes, "But that's pretty cool though. You know, let me see it when you're done." He's like, "Oh, I see the clinic." He took up from me so much. God. And this is where I talk about my like depressive issues. Where the gratitude and the appreciation and stuff. I remember the incidences, but the emotions are not connected to it in a way that they should be. Or I don't feel that they, you know, that I'm connected to it in a way that they should be. But there was a day back in band camp, one of the NCOs had called me out of the lab to run x-ray, which I knew how to do. I mean, it was too easy. Anyway, they called me out to run lab and run the x-ray out of the lab. And my lab was, you know, doctors and the assistants were having to pour their own models, and my lab was getting fucked up, right? Anyway, this was one day because they had asked me to run x-ray. And I went ahead and I did it because they asked me, because I was in the military. It was like, do as you're told, you know, kind of thing. Anyway, the second day that they asked me to go back there, my Dr. Dolsky jumped up and he was like, why are you calling my dental lab tech out of her AO to run your x-ray section? And they're like, well, she's the only one who knows how to run the Panorex. And he was like, you mean to tell me that there is not one NCO in that back office and headquarters or up here at this desk that cannot run that machine? And they just stood there and looked at him. And he was like, because if they can't, then they should not be NCOs. She is to stay in that lab where I need her at my beck and call. Do not ever ask her to come up here and run this again. And not to mention, she doesn't even belong to the clinic. She belongs to headquarters. She belongs to the colonel. So the next time you want her to do anything, close up the clinic, run the desk at the clinic, cover lunch at the clinic, input data for the clinic, you have to go through him in order to use her in your AO. Have I made myself clear? I sat there. I literally overheard this whole conversation. I'm standing in the records, like, around the corner. Like, holy shit. He's sticking up for me. Mm-hmm. Oh, yeah. So, his Yelp reviews or whatever from 10 years ago, or, you know, His bedside manners can be ugly as they want to be. I don't care. That man had my heart. He took up for me. I was smart and they took advantage of it. I had skills and they took advantage of it. So, I look at a lot of these, like dentists, like the dentist. I fucking love him. He's great. There's a lot of things that he skips over the details. Where he's like, ah. Yeah, I was doing that with him one day. Yeah, I can't remember which video it was, but he was like, ah, and I was like, ah, and then I was laughing because we reacted the same way. I think it was the calculus one. I ran into one of those. Oh my God. My colonel came back to me and he was like, what can you do with this? I said, nothing. I said, I'm not even going to try to sandblast that bitch. I'll make him a fucking new one faster than I can clean that. I said, I'm trying not to be rude. But I can make him a new one faster than I can clean that. And he was like, that's what I thought you'd say, and I was hoping. This thing had like a half inch of... Oh, it looked like something that had grown on the Statue of Liberty. There was green in there. It was gross. It was fucking gross. And he was trying to be calm. Oh, Steely Dan. This kind of spins off the... we gotta write that down. Where's my pen? Steely Dan. I gotta add that to my writing list. Hang on a minute. Steely Dan. That was my colonel's... we used to listen to Steely Dan all the time. We had this boombox in there, and we had a fucking Steely Dan CD, and yeah, that was our thing. Anyway, so long story short, I have had a lot of experience with some gnarly shit, and my biggest fascination here recently is implants, and wondering if should I go with implants or should I just yank them and wear the traditional. I'm thinking I'm probably going to go traditional on top, but it might not work. It's the bone structure. And what is going to determine how well your dentures fit is to how much bone structure you really have left to support the actual denture. And that is basically the gist of it. Right here in the front, I have no bone structure. I will have to do an implant across this front 6. I will have to. Now, if I do a partial type of denture along the back, will be strictly determinant on how much bone I have left in the lower aspect of my mandible. As far as my upper aspect, my teeth are huge. They are literally like, this is why, like, every time I get a head cold, I get a, like, this one, and this one are like freaking out. My teeth is because they're right in the sinus cavity. Every time I get a head cold or some kind of upper sinus type of infection, it's not just my lungs or my throat that's bothering me. My whole face hurts. Because my teeth are stupid long And they're literally, the apical aspects of the root structure is literally sitting like a millimeter under tissue. They're penetrating my sinus cavity because I got stupid huge teeth. These are shorter than what they're supposed to be. I had them filed. These are shorter than what they used to be. They've all been filed. Yeah. These are actually like a millimeter shorter. Every one of them. From like back here to there. They're all a millimeter shorter than what they used to be. Because when I was scourging, I was breaking the bottom teeth off. I chipped bottoms. Because of the length. Yeah, jacked up mouth, and I was in a laboratory technician. I get it. I understand. But anyway, you get the idea. So, I am going to be one of those hybridized peoples that I dealt with back in the day, 20 plus years ago. So, why do I watch this stuff? I'm educating you from the layman's perspective. If you want to find out what's going on with your head, if you got fucked up teeth like me, yeah, I'm going to admit it. Yeah, I was going to be a dentist. And they got worse when I was pregnant. They were bad before, but then they got 10 times worse when I was pregnant. And it has been everything in my power from the time my daughter was born in 1999 until now to keep my real fucking teeth in my head. I am now 54 years old. And you know what? It doesn't matter. Brushing them, it don't work. Flossing them, I have no problem flossing my teeth now. Every single one of my teeth has been filed to give me space to floss it so I didn't shred floss. That's how crowded my head was. So, little bit of educational FYI on the dental aspects of things. Watch it if you want. Ignore it if you want. But I'm speaking from personal experience. I know within the next 5 years, every single one of these are going to be yanked. And I'm going to have full dentures. And we will go through that journey then. But until then, y'all have a great night. I'm doing pretty good today. The ice store doesn't seem to be emptying though. Y'all, be safe, be good, say a prayer, peace.